Have you recently experienced any episodes of coughing, difficulty in breathing, and any other related symptoms?
Are you aware that these are frequent signs of respiratory conditions?
Even a minor cough can worsen and become dangerous to oneself if left untreated.
We are RespiraSquad, and if you're in doubt, watch this video to learn about the 5 respiratory diseases we will be discussing.
Have you recently coughed and noticed any green, yellow, or red mucus? Keep an eye out on these symptoms, which specifically lead to pneumonia.
The most common type of pneumonia is called pneumococcal pneumonia, and the scientific name of its fungus-causing infection is caused by Streptococcus pneumoniae germ that lives in the upper respiratory tract.
Pneumonia is an acute respiratory disease. This means it is a short-term respiratory disease and can be resolved within weeks. Pneumonia is a communicable disease. This means that it can be transmitted from one host to another. It can either be caused by bacteria, fungi, virus, or mycoplasma.
The causes of infection of pneumonia are bacteria, tiny organisms such as Streptococcus pneumonia, viruses. The same viruses associated with the nasty flu and cold are also the ones that wreak havoc within your lungs. Fungi. Fungal infections can also lead to you having pneumonia. Inhaling. By inhaling air that is carrying pneumonia, which can also lead to infections.
Mode of transfer. Some types of pneumonia are contagious, meaning it spreads from person to person. Pneumonia is mostly spread when people infected cough, sneeze, or talk, sending respiratory droplets into the air. These droplets can then be inhaled by close contacts. Less often, you can get pneumonia from touching an object or surface that has a germ on it and then touching your nose or mouth.
These are the signs and symptoms of pneumonia. Cough, which may produce greenish, yellow, or even bloody mucus. Fever, sweating and shaking chills. Shortness of breath, rapid, shallow breathing. Sharp or stabbing chest pain, loss of appetite, low energy and fatigue. Nausea and vomiting, especially in small children. And confusion, especially in older people.
Target age group and attack rate. Although all age groups can be affected, it is more common in younger children. Pneumonia accounts for 13% of all infectious illnesses in infants younger than the age of 2. It is also severe among adults and elderly aged 65 years and above.
Some of the examples of home remedies for pneumonia are: stay hydrated. Drinking enough water and electrolytes while you have a fever can help you prevent dehydration. Drink hot peppermint tea. Peppermint can also help alleviate irritation and expel mucus. Rest. Get plenty of rest to allow your body to heal and conserve energy. Maintain good hygiene. Wash your mouth regularly and cover your mouth and nose when coughing or sneezing to prevent the spread of infection. Eat a healthy diet. Eat nutritious food that supports your immune system, such as fruits, vegetables, whole grains, and lean proteins. Some of the examples of medical treatments for pneumonia are antibiotics. If the pneumonia is caused by bacteria, your doctor may prescribe antibiotics to treat the infection. Antiviral medications. If the pneumonia is caused by a viral infection, antiviral medication may be prescribed. Antifungal medications. If the pneumonia is caused by a fungal infection, antifungal medication may be prescribed.
So to summarize it up all, pneumonia is a respiratory disease that can be caused by bacteria, fungi, viruses, and mycoplasmas. It can be spread from person to person through respiratory droplets, and some common symptoms include high fever, shortness of breath, and chest pain. Pneumonia can affect people of all ages, but it is mostly common in children, youngers, and elderlies. Home remedies such as staying hydrated and getting plenty of rest can help, but medical treatments like antibiotics, antiviral medications, and antifungal medications may be necessary depending on the infection.
Have you had a croppy or parking cough along with a sore throat and shortness of breath? You might believe these are typical, but they are actually related to tracheitis.
The name for this disease is called bacterial corp, or also known as the laryngotracheobronchitis, and this disease is most often caused by the bacteria Staphylococcus aureus.
Tracheitis is an acute respiratory disease. This is because it usually lasts within 1 to 3 weeks. It is also a communicable disease, which means it is contagious, commonly caused by bacteria.
Of infection of tracheitis, bacteria. It is often followed by a viral upper respiratory infection. Viruses. Similar to cold, viruses can also directly infect the trachea. And also, inhaling chemical irritants. They can mimic the symptoms of tracheitis and they can inflame your trachea.
Mode of transfer. A tracheitis is an infection that occurs in the trachea. However, the symptoms are the result of a viral or bacterial infection. It could be contagious. In viral tracheitis, they are transmitted through respiratory droplets, and it is when a person coughs, talks, or sneezes and the other person inhales these droplets. While bacterial tracheitis usually occurs in children, usually they spread via respiratory droplets or coming into direct contact with the respiratory secretions of the infected individual.
Tracheitis is associated with severe croupy or dry cough attacks, chest pain due to coughing attacks, difficulty in breathing, severe pain in the trachea, high fever and low-pitched voice, coughing up blood, sore throat, stridor or high-pitched whistling when taking in a breath, and wheezing.
Target age group and attack rate. Tracheitis commonly affects children between the ages of 6 months and 14 years.
Some of the examples of home remedies for tracheitis are steam inhalation. Inhaling steam can help soothe the inflamed trachea and alleviate symptoms. Boil water and pour it into a bowl. Place your face over the bowl, cover your head with a towel, and inhale the steam for about 10 minutes. Be cautious to avoid burns. Warm liquids. Drinking warm liquids such as herbal teas, warm water with honey and lemon, or broth scone helps soothe the throat and provide relief from coughing and discomfort. Rest and hydration. Getting plenty of rest and staying well hydrated by drinking fluids can help support the immune system and promote healing. Some of the examples of medical treatments for tracheitis are antibiotics. If the tracheitis is caused by a bacterial infection, antibiotics may be prescribed by the healthcare professional to treat the underlying infection. Anti-inflammatory medication. Non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen may be recommended to reduce inflammation and relieve pain associated with tracheitis. Always consult a healthcare professional before taking any medication. Bronchodilators. In cases where tracheitis causes difficulty breathing, bronchodilators may be prescribed to help open up the airways and improve breathing.
So to summarize it up all, tracheitis, also known as bacterial croup, is an acute respiratory disease caused by bacteria, particularly the one called Staphylococcus aureus. It is contagious and commonly affects children between 6 months and 14 years old. Some treatment options include antibiotics for bacterial infections and home remedies such as steam inhalation and warm liquids to alleviate symptoms.
Did you know that a particular specific foul-smelling cough with blood and chest pain is associated with a lung abscess? Be mindful that this illness is identical to pneumonia.
There are different kinds of abscesses, and one of them is the lung abscess. The scientific name of it is called the lung gangrene or empyema. A lung abscess is a microbial infection, and the fungus that causes the infection are called Aspergillus, Cryptococcus, and Histoplasma.
A lung abscess is an infection in the lung caused by microbes, leading to tissue death in the lung. Depending on how long it lasts, It can be categorized as either acute, lasting less than 4 weeks, or chronic, lasting more than 4 weeks. It is a communicable disease, meaning it can be passed from one person to another. It can either be classified as primary or secondary. Primary lung abscesses are caused by infections within the lungs. Secondary lung abscesses are caused by things other than an infection that starts with the lung.
The causes of infection of abscesses are Staphylococcus aureus and Streptococcus pyogenes. They are the most common culprits that causes abscesses. Foreign objects stuck. Objects such as splinter, dirt, and other objects that are stuck under your skin can trigger abscesses. Weak immune system. People with old age are often associated with abscesses due to their immune system having a hard time fighting off.
Mode of transfer. The most common mode of transmission is by person-to-person contact with infected nasal and oral fluids. Transmission occurs by breathing airborne droplets or by contact of eyes or nose with contaminated hands. RSV infection is often carried home by school-aged children and passed to younger children.
These are the signs and symptoms of lung abscess. Chest pain, especially when you breathe in, cough, fatigue, fever, loss of appetite, night sweats, sputum, or a mixture of saliva and mucus with pus that's often sour tasting, foul smelling, or streaked with blood, and weight loss.
Target age group and attack rate. Abscesses can occur at any age, from infants to the elderly. However, it is more predominant in adults aged 65 and above. The mortality rate for lung abscesses in adults can reach as high as 15 to 20%, while children have mortality rates typically below 5%.
Home remedies for abscesses. Salt water rinse. Rinsing your mouth with salt water can provide temporary relief for an abscessed tooth. Mix 1/2 teaspoon of salt with 1/2 cup of warm water and rinse your mouth with a solution for at least 2 minutes. Baking soda. Baking soda can also help manage an abscessed tooth. Mix 1/2 teaspoon of baking soda with 1/2 cup of water and a pinch of salt. Swish the mixture in your mouth for up to 5 minutes and then spit it out. Oregano essential oil. Oregano oil has anti-inflammatory, antimicrobial, and antioxidant properties that may help reduce the swelling and pain of an abscessed tooth. Dilute a few drops of oregano essential oil with a carrier oil and apply it to the affected area using a cotton ball. Leave it on for at least 10 minutes and then rinse. Medical treatments for abscesses. Incision and drainage. A doctor can perform a procedure called incision and drainage to open the abscess and drain the pus and debris. Antibiotics. In some cases, antibiotics may be prescribed to treat the infection associated with abscess.
So to summarize it up all, the common name for the disease abscesses is still abscesses, with different kinds occurring in the skin, under the skin, in the teeth, or in the lungs. There are a lot of abscesses, so there can be either acute or chronic, or secondary or primary. They can be transferred through open and draining infected areas, and common symptoms include chest pain, cough, fatigue, and weight loss. Abscesses can occur at any age, but they are more common in adults, such as those who are 60 and above.
RSV is also known as the respiratory syncytial virus, and it usually causes mild to cold-like symptoms, and there is no fungus-causing infection.
Respiratory syncytial virus is an infectious virus that causes respiratory tract infections. It is a single-stranded RNA virus with negative sense. The term syncytia refers to the enormous cells that result from the fusion of infected cells. It is an acute respiratory disease because it lasts within 2 weeks and it is also contagious.
The causes of infection of RSV. Direct contact. Close or physical contact with an infected person can also have you infected with RSV. Crowded environments. RSV can spread easily to crowded places such as schools or daycares. Contaminated surfaces. Touching contaminated surfaces and also rubbing it on your face can also lead you to having RSV. Age. Infants or children under the age of 2 years old are at higher risk of having RSV.
Mode of transfer. The most common mode of transmission is by person-to-person contact with infected nasal and oral fluids. Transmission occurs by breathing airborne droplets or by contact of eyes or nose with contaminated hands. RSV infection is often carried home by school-aged children and passed to younger children.
Signs and symptoms of respiratory syncytial virus. First is fever, then severe cough, wheezing, rapid breathing, bluish color of the skin due to lack of oxygen, runny nose, dry cough, sore throat, sneezing, and headache.
Target age group and attack rate. RSV commonly affects infants and young children, particularly those under the age of 2. However, it can also affect older children and adults.
Some of the example of home remedies for respiratory syncytial virus or RSV are relief pain. Relief pain help ease muscle aches, headaches, and sore throats. For ear pain, you can also put a warm washcloth over the ear. Stay hydrated. Make sure there is a salt and sugar in their fluids if they are not eating. Apple, juice, water, soup, and foods like watermelon and cucumber are also great sources of hydration. Pick up steam. Run a cool mist humidifier and give steamy baths. The water vapor loosens congestion. Take note. Use a cool mist humidifier rather than a vaporizer, which are a burn hazard. Honey. Honey works as well as popular over-the-counter cough medication without the side effects. Some of the examples of medical treatment for respiratory syncytial virus or RSV are intravenous. The hospital will use intravenous fluids to aid in hydration, and a breathing machine or humidified oxygen to help your body receive the oxygen it needs. Antiviral medication. In severe cases or for individuals at high risk, antiviral medication may be prescribed by a healthcare professional. Oxygen therapy. In severe cases where oxygen levels are low, supplemental oxygen therapy may be provided in a hospital setting. Hospitalizations. In some cases, especially for infants or individuals with underlying health conditions, hospitalizations may be necessary for close monitoring and supportive care.
So in summary, respiratory syncytial virus or RSV is an infectious virus that causes respiratory tract infections, which can also be treated with home remedies such as pain reliefs and staying hydrated. Or you can also use medical treatments like intravenous fluids or antiviral medications. Or in severe cases, hospitalization may be required.
The common name of the influenza disease is called seasonal disease or also known as flu. It also doesn't have any fungus-causing infection.
Influenza is an acute respiratory infection that lasts at least 4 to 7 days and it is contagious. Influenza viruses come in 4 varieties: A, B, C, and D. Seasonal illness outbreaks are brought on by the spread of the influenza A and B viruses. Influenza A viruses are further divided into subtypes based on the patterns of the viruses' surface proteins.
The causes of infection of influenza. There are 3 main types: influenza A, B, and C. They mutate frequently, leading to new strains discovered every year. Coughing, sneezing, or things such as talking can also lead to you having the influenza in tiny droplets that are spread and infected through the air or physical contact.
Mode of transfer. Influenza or viruses are believed to spread between humans through exposure to respiratory droplets expelled during coughing or sneezing from infectious individuals.
These are the signs and symptoms of influenza. First is headache, dry cough, shortness of breath, tiredness and weakness, runny nose or stuffy nose, sore throat, eye pain, gray or blue lips or nail beds, and dehydration.
Target age group and attack rate. Influenza occurs all over the world and at any age group, with an annual global attack rate estimated at 5 to 10%. Again. Target age group and attack rate. Influenza occurs all over.
Some of the examples of home remedies for influenza are drink plenty of liquids, choose water, juice, and warm soups to prevent dehydration. Rest. Get more sleep to help your immune system fight infection. You may need to charge your activity level depending on your symptoms. Consider pain reliever. Use acetaminophen or ibuprofen to combat the fever, headache associated with influenza. Some of the examples of medical treatment for influenza are oseltamivir phosphate. Take oseltamivir by mouth as a pill or a liquid. You usually take it for several days. Zanamivir. Breathe zanamivir in through your mouth with an inhaler. Usually you have to take it for several days. Take note. Zanamivir isn't recommended for people with breathing issues like asthma. Peramivir. Provider gives you peramivir directly into your veins. Usually, it only needs 1 dose of peramivir. If you identify yourself to have one of 5 that we've discussed, it's better to take action immediately. Seek for a doctor as soon as possible and follow all necessary medications and guidelines to effectively treat your condition.
To sum it all up, influenza is caused by different types of viruses, with influenza A and B being the main culprits for seasonal outbreaks. And some home remedies like staying hydrated, resting, and taking pain relievers can help manage influenza symptoms. Medical treatments like oseltamivir, zanamivir, and paramivir are also available for more severe cases.
Now that we've covered 5 of the numerous respiratory illnesses, we hope to have increased your knowledge.
Always keep an eye on yourself and look for the signs and symptoms of each diseases.
If you identify yourself to have one of 5 that we've discussed, it's better to take action immediately. Seek for a doctor as soon as possible and follow all necessary medications and guidelines to effectively treat your condition.
Once again, we are the RespiraSquad. I hope you inhaled our discussion today. See you in the next video.